Matthew Holt, another THCB spotlight here. I'm here with Joanna Strober. She is the CEO of Midi, and Midi has been making some waves lately, among other things. One of the finalists, one of the winners in the Digital Health Hub Awards that we were both at back in a few weeks back in health, and also raised a bit of money through Google Ventures and some others to do. So, Joanna, to do what? You guys are in the business of menopause, and well, not in the business of creating menopause, in the business of helping manage menopause. So, before we start about Midi, look, presumably women are going through menopause for thousands of years, and we've had a medical system around. My dad was an OB/GYN. I'm sure he dealt with women who had menopause. What's up with menopause that it's a problem? We are seeing a lot of interest in it finally for digital health, but why is this a problem now compared to what it was like before?
So here's a little bit of history. There was a Women's Health Initiative study that happened in 2002 that prior to that study, many women were taking hormones and they benefited pretty dramatically from them. That study seemed to show an increase in risk of breast cancer for women taking hormone replacement therapy.
Sure.
As of that day, all hormone replacement therapy stopped. All research on women and estrogen stopped. And literally for the past 20 plus years, there's been this silence around the treatment of menopause because we all know now that by far the best treatment was hormone replacement therapy, which went away, which meant that quite honestly, women have been getting snake oil for the past 20 years instead of medical care. Recently, that study has been seriously re-examined and proven to be, as many say, one of the great points of malpractice in modern medicine. And the study does not show an increase of risk in breast cancer. It actually shows a decrease in breast cancer for women who are on estrogen. It also shows that Alzheimer's can be prevented, cardiovascular disease can be prevented, diabetes. Estrogen is truly the fountain of youth for women, and I'm not actually joking when I say that. So what's happened is that these studies have been reevaluated, and it shows that actually care is available. And that's the big difference. And so now, finally, doctors are writing these reports and saying, there's great care, you should get access to the care. But that said, Matthew, no one has any training on this care because for the past 20 plus years, no doctors have been trained in this. So the reason companies like us need to exist is we actually have to train the practitioners to do the care. There's no one who's trained to do it. So that's the gaping hole of menopause care. That's why it's finally starting to get, the attention that I think it deserves.
So I absolutely recall my stepmom was on that therapy, and my dad, was to that point was still practicing, going to medical conferences, and he came back and he said, "I couldn't get a clear answer to anybody about it. Does it cure you or kill you or whatever?" And so I'm not, so my stepmom actually stayed on her hormone replacement therapy because it was helping her with menopause, and so let's talk about the inverse, right? So that's why it hasn't been thought of and treated. And, there are a lot of cases where medical studies direct us in one direction or another for reasons that aren't necessarily the right ones. But what's the impact of menopause on not only the women, going through it, but also on the rest of society in terms of costs that you're dealing with?
So around 35, women's estrogen starts going down. And so when you talk about menopause, I just want to say menopause doesn't mean anything. Menopause means you haven't had your period for a year, right? So what I'm talking about is women's health. And I'm talking about the fact that estrogen starts going down around 35. There are at least 32 symptoms that come from this: anxiety, depression, joint pain, sleep issues, brain fog, decreasing bone strength. I could just go on and on with all the different things. And what's happening mostly is that women, if they have access to care, they polyshop. They go to one person for sleep, someone else for depression, someone else for their brain fog. And no one is shepherding and saying, you are a woman first. I can actually solve all of these things in one visit. You don't have to go to 5. And so we are saving the system a lot because we can work with women early. We can identify, here are all the symptoms of menopause, and we can get you on the right path. So you don't have to go to 8 doctors in order to feel better.
So let's get into Midi a little bit. Tell me a bit about your story of getting it going, and then tell me about what it does, because there are a number of companies we see in digital health which are sort of working with the current system and current doctors. There are others who are taking it soup to nuts and taking people out of that system and dealing completely with their diabetes or their IBD or whatever it is separately. So just give me a sense of how you started the company and how you're positioned now.
So we are a midlife care company for women with a focus on perimenopause and menopause. We spent a year developing care protocols for all the things that women go through. So we have a brain fog protocol, we have a sleep protocol, we have a weight protocol, we have protocols for all the different issues that women are experiencing during this time frame. And we've created Midi University, which is a training session for women, for NPs, excuse me, to get trained on all of these care protocols. We also importantly have a survivorship protocol. So we have an entire system for women who have breast cancer who are unable to take hormones. So we have a program for them as well. So we developed these care protocols, and then we train NPs to do the care, and then we get in network with insurance companies. So fundamental to our company is access to great care, which means insurance covered care. It means not expensive concierge care, but instead access to great care covered by insurance. And so we're currently in 14 states, and we should be actually in all 50 states next year, providing care. And essentially we are virtual only. So we have no in-person care. So we will partner with your in-person providers if you have one, and to make sure that you have in-person when necessary, but we are just only doing the virtual care.
So what's the experience? So I'm a woman. I'm not a woman. If I were a woman, I had these issues.
Yeah.
How would I find you? How would I get directed to you? And then what would happen next? And I assume many, not if not a majority of women have a regular gynecologist they might be going to see anyway. How does it work with the current health system? And then how would I find you in the first place? And what would happen next? What's the experience I go through?
So 40 to 50% of the women who come to us don't have a regular doctor. So I just want to start with that.
I said many, but not most. I know that most people don't have primary care doctors, and
most people don't have a doctor, right? So many of the women coming to us haven't gone to a doctor for 4 to 10 years, other than urgent care. So they find us online. They find us through Googling menopause symptoms. They find us through, Googling other symptoms. They find us online, and then they come, you book a visit. There's no membership fee. You just come to us, you book a visit, and it's paid for by your insurance in the same way as going to a local doctor, except it's virtual. So most women end up doing for their phones instead of any place else. And they can do it. We find them doing it from closets or from the car or from wherever else they are during the day. You're not allowed to be driving. That's important. But we have women pull over to the side of the road. So you have a scheduled visit, just like you're going to it. And it's all synchronous. It is not asynchronous care. We have providers who talk to you for 30 minutes about your symptoms. They also find out, have you had a mammogram? And if you haven't had a mammogram, they send you to get that. Have you had a colonoscopy? Are you up to date on your immunizations? We view ourselves as partially primary care as much as we view ourselves as specialty care. So we make sure you get the right blood tests and everything else. And then we give you prescriptions and we send you to the pharmacy to fulfill your prescription. We're not selling you products. We are fundamentally a care company that takes care of women for all these issues. And there are a lot of them. And then women usually come back to us 2 or 3 times for some titrating. And then they might come back the next year to update their prescriptions.
So you're essentially, as you said, a midlife care specialist. How does this work when a patient has got a regular relationship with you, an OB or a primary care doctor, and is sort of working on this? Are you necessary then? Are you superfluous? Do you work with them? How does that work?
We do. We get quite a few referrals from other doctors. So we get referrals from primary care doctors. We get referrals from OBGYNs. We get referrals from marriage therapists. We get referrals from all sorts of different providers who take care of this population and don't have the time or expertise to spend to have these in-depth discussions. And so they send them to us, and then we use Athena, and we integrate with your healthcare system, so we can share records. We can collaborate with your physician. If you have a cancer doctor, we'll collaborate with that doctor to make sure that we're coordinating medication appropriately. So we are very much integrated into the medical system. We don't want to be separate. So we think it's really important for us to be integrated into the entire system.
So you're a medical group,
Yeah.
treating this specialty, which sounds great. And then obviously now related to that, there are a lot of other medical groups in the femtech women's health space. Most of them being concentrated sort of towards not the other end, but further earlier on in a woman's life around sort of fertility and childbirth. We've seen a ton of interest from employers, especially in sort of providing for infertility and issues around that. You have companies like Maven, Avia, and others who started in that direction. Do you see yourself colliding with them? Is that a partnership, or is it just people haven't focused at, I say, as women get older, and we hear a lot about them being ignored and their issues being ignored. We've seen this happen in healthcare and medicine, not included in clinical trials, not focused on for cardiovascular issues. All this stuff has been going on for years. Obviously, the menopause, midlife issue is a big one. How do you see that playing out? Do you think you end up going to more symptoms for women, and these other companies stay where they are, or how do you think it plays out?
So we're talking about half the country, right? So there's a lot of women. I guess I'm less worried about colliding with other companies at the moment, because this is such an underserved market. There are very few care providers nationwide. So we are, as fast as we can, training care providers to get launched on our platform and provide this care. We are not limited because we're not limited because someone is competing with us really in anything. I can't wait till that happens, but honestly, we're a long ways off from worrying about that.
Well, I mean, and to be fair, just thinking about the sort of the menopause midlife market, and I can now name 2 or 3 people who are in that space with you, who've been there for a couple of years, but it's been it's took a long time for this to come, right? As you mentioned, partly it's clinical, and partly the issues around that, and partly it's just it hasn't been focused on by investors and others. When you go, I love to talk about the investment side, because you just did close a decent sized round, which was great. But before we get there, when you go to an insurer, what's the conversation? Are you saying this group of women have not been taken care of properly, or are they much more on the ROI? If we pay for these visits, how much are we saving in other areas? What's the conversation been? If it is on the sort of hard numbers, what are the numbers you've been giving them?
So we're an in-network provider within insurance companies, right? So we think of us like a primary care provider, right? We're billing standard codes that already exist. We're not separate in our codes. So we're an in-network provider, and we get in-network. We put our doctors and NPs, we credential them with the insurance companies. So I believe long-term, we're going to show significant cost savings for these insurance companies. But as we are developing that business case, they're seeing the data, and they're excited because we're showing really good data to them that women are engaged. We're sending a lot of colonoscopies. That means we're preventing cancer. We're sending mammograms. That means we're preventing cancer. We are also identifying women who have cancer and getting them early treatment. So we are quite able to save the system a lot through the preventive care that we're doing. And if you think about the fact that 50% of the women who are coming to us don't have a primary care or an OBGYN, we are getting them early care, which is very important for the cost savings to our insurance companies.
Yeah, and also for the overall quality and the metrics that the plans are dealing with, NCQA and everything else. That's this, as you said, it's been an ignored group. Talking about that, I noticed on your website you mostly been talking with insurers. What about other public programs, Medicaid, state programs? Medicare. I don't know if Medicare, by the time the rationale that your life changed at 65 doesn't make a lot of sense to me, but as somebody who's getting towards that number,
Yeah.
What about your approach? I mean, particularly Medicaid, which deals obviously with a huge number of women around childbirth, that area, that age. Where are you in that process?
We are working on that, so I'm hopeful that it's an important population to us and people that we really want to access care. So we have started with commercial population, but we certainly want to be offering Medicaid care.
All right, fantastic. Let's talk about the company a bit. When did you start it? And then talk a little bit about the recent raise you just had with Google Ventures and others.
Yeah, so we started in 2021 and we launched in the summer of 2022 to new patients. We're now in 14 states. Actually, today we opened 2 more. So we opened Ohio and Michigan today.
Fantastic. So does that make you 16 or 14?
I think somewhere in there. I'm forgetting that.
Okay.
But we raised money to expand to all 50 states. And in addition, we're starting to work with healthcare systems to be a virtual menopause partner to them. And so we're working on expanding that. And we're also working with employers. So now offering care to employers in all 50 states. And essentially we bill everything through claims for them. So there's no extra cost for them. It is a partnership where we provide information and education for their employees, and they get access to our care. But again, it's all billed through claims. So it's not an additional cost for them. So really the money, Google Ventures is a perfect partner for us. They are deep investors in women's health, and they know a lot about women's health, and they've been a great partner for us.
That's it. What was the round? How much was the round total?
25.
And how much did you raise before that?
We'd already raised 15, so we raised 40 million.
Okay, so yeah, I mean, I'm building a medical group. I mean, I've talked with many people in this space of different flavors of virtual medical groups, and it's not as cheap as you'd think. It's so give me some metrics for numbers of clinicians you have on the team now, or numbers of visits you're facing now, and then tell me what good would look like from your new board from your new board in a couple of years. Where are you planning to go?
Kathy Friedman, who's an investor at Google Ventures, said that she thinks this is a failure unless we're seeing 1 million women a year.
I assume you're not seeing 1 million a year yet. So where are you now?
No, we're not there yet. But you asked where we're going to go. That would still be a small percentage of the population. So I'm just putting it out there.
Okay.
And I'm building to get there. But we are going to see many, many thousands of patients this year. So tens of thousands of patients this year, many tens of thousands. We're growing really fast. The demand is significant. So we are actually not at all capped by demand. We're capped by how fast we can train and credential all of the providers. So by the end of the year, we should have over 100 trained providers, and we take that honestly very seriously, the training and the monitoring and making sure that we're offering incredibly high quality care to the women who come to us. So as I mentioned earlier, there's not enough training out there. There are not enough trained providers. So we have a very intensive training program for them and monitoring them, and then making sure that, if you had cancer, that you're only going to the cancer specialists, or if you have other health issues that we need to be aware of, we're getting the right expertise for those women. So the care is where we are focused, and we don't want to expand. We can't expand faster because of that. So that's really the gating factor.
I mean, as in many areas of healthcare, especially it's something fairly new, and people haven't really figured out how to do this management piece for I would say a new group of people, new group of patients, because it's been around forever, but for a new way of looking after those folks. Well, on the demand, it takes a while. On the demand side, two questions, and so number one is how many women, assuming all women who get to the age of get to midlife, how many of them do you think need this kind of specialty care? Go through as you mentioned on your own website about your own life. 90% you think have got issues that need this kind of care. Wow. So everybody basically.
It's everybody.
Right. And then what is you mentioned a lot of referrals and this, that, and the other. What do you think the long-term customer acquisition strategy for you is? I mean, is this like, late night infomercials? I mean, how do you get?
No, you joke.
I mean, I'm not joking. I mean,
no, right. I think
it is a consumer customer acquisition strategy, and you see hospitals everywhere sponsoring sports stadiums and what have you. There's a reason for that. Well, maybe not really a good one, but what's your strategy there?
I think that it's really all of the above. As I said, we're seeing referrals from employers, we're seeing referrals from physicians, and we're doing direct to consumer, and they're all working. And I think that there's a lot of different opportunities to grow. There isn't really a national healthcare company yet. Maybe One Medical was close, but I believe over the next few years we will see some national healthcare companies emerge, and we want to be one of the leaders. And there really isn't even a midlife women's brand out there. So I think that we have a chance to build a big women's healthcare brand and be the experts in women's health. And that's really, there are lots of different ways to get there.
But you're determined to do so. That's fantastic. Well, I think that gives us a great explanation of what Midi is. I've been talking with Joanna Strober. She is the CEO of Midi. As we mentioned, they just raised $25 million from Google and are out to become a national a national brand in women's midlife healthcare, which, as we discussed earlier, needs a lot of help. Joanna, thanks for your time.
Thank you. This is fun.